1 in 8 men will be diagnosed with prostate cancer. So how do you keep yourself safe? Joining us this morning is Dr. Carl Rossi, Medical Director of the California Protons Cancer Therapy Center. Doctor, good morning. Thanks for being here. Obviously this conversation, Defense Secretary Lloyd Austin, the news came out earlier this week that it was prostate cancer that landed him in the hospital. I wanted to talk about catching this early and getting checked, because a lot of men, it's still an issue that they don't want to get this checked out. Where are we now?
Well, I think we're getting better. I mean, we have great tools to detect it early. The improvements have really been in awareness that gentlemen should get screened, and we all know how stubborn men can be. Screening for prostate cancer with PSA testing is very straightforward, very easy. You should generally start having the test done at age 50, unless there's a family history. And by following the results, you much more often than not will have an idea about what's happening, getting diagnosed, and then if you're diagnosed, what you need to do, if anything, to intervene.
It seems frustrating that there's a stigma with men and with this particular type of cancer, where if it was any other kind of cancer, you would go to the doctor and get it checked out. I wanted to talk to you about treatment. We heard from Secretary Austin. This was an elective surgery. So depending on how early you catch it, is there a choice? Is there an option in terms of treatment?
Sure, there are multiple options to cure prostate cancer. In general, you can either have surgical removal, which is called a prostatectomy, what he had.
That's what he had. And that's minimally invasive, correct?
Well, I'm not a surgeon, but it's a significant operation. There's a lot of anatomic changes that occur, and there's several hours of surgical time. Good way to cure prostate cancer. There are non-invasive ways which are equally effective, which are radiation therapy. And we can do this with x-rays, we can do this with protons like I do at my facility. There are other ways to do that as well. And there isn't a difference in cure between these modalities. There's a difference in the method and difference in the side effect profile. And like you'd imagine, with non-invasive treatments, you avoid certain things that are a little bit more common with an invasive procedure.
And the secretary was under full anesthesia, and then they had the complications where they had to rush him back to the hospital. Among them, there was nausea, there was abdominal pain, hip pain, leg pain. He had a urinary tract infection. My goodness. How rare are those complications, I guess, from a surgery like that?
They're relatively rare, fortunately.
Really?
I mean, they're not unheard of, but the vast majority of patients do not experience complications that require return to the hospital.
Yeah. How do they make a decision? Like, how do you make decisions on whether or not somebody gets the treatment, like with protons, for example, or if they need surgery, or if that's an option?
Well, remember, there isn't a difference in cure rates, so far as we can tell, between surgery and radiation. There's a difference in the side effect profile, in particular, risk of urinary leakage. Also, gentlemen that are a little bit older or have other medical issues are less favorable candidates for surgery because of the concerns over the risk to their health. So usually the decision is based on patient preference. You sit down with them and say, this is how method A works, this is how method B works, and some will pick one, some will pick the other.
It's unbelievable. The California Protons Cancer Therapy Center, when you hear protons and you hear all this stuff, to the layman, obviously, that sounds like, what is that? And how is that different from the normal treatment that you've heard so much over the years, like chemotherapy and this and that?
Sure.
Explain what that is.
So proton radiation therapy is a type of radiation treatment that, instead of using x-rays, which is what most people receive when they get radiation treatment, we're using subatomic particles, protons. Why? Because they stop. So this allows the radiation to be delivered to the target with far less dose to the healthy tissue outside the target than is common with x-ray therapy. And it's an old idea. It was first used in the mid-1950s, but like everything in technology, we've now gotten to the point where we can do this routinely, 100 patients a day, using it for all the types of cancers that are typically treated with radiation.
Do patients need to ask for this kind of treatment? Will doctors suggest it? How do I get this if I need it?
Yeah, the people come to us in varied ways. I'd say at least a third of the patients that I see for prostate cancer are patients who I've treated, their friend, their father, somebody that they knew about. There are currently 40 plus proton centers in the United States, but that's still relatively a drop in the bucket.
Sure.
So sometimes they're referred by their physician. A lot of times it's patients doing, getting on the internet, which is good, and doing their research and finding out about it.
The most common treatment options, I don't know if watchful waiting is one, but explain what that means.
Yeah, so there are many gentlemen with prostate cancer where the disease is very, very slow moving and they may be, somewhat older, and you look at their life expectancy, and you can actually safely observe them doing regular testing, and they may never need treatment, or the testing is designed to hopefully pick up the disease, any changes in the disease, so that you can then say, right, we have to treat you as opposed to watching you.
Catching it early, as always, is critical, right? And if you do that, the prognosis for after treatment, for example, with the secretary, prognosis is good overall?
It's generally good to excellent, especially, as you'd imagine, early diagnosis rarely leads to a worse outcome.
And this is why we have you on here, because you just got to go get yourself checked out. It's your due diligence, it's your health.
Yeah, and
right?
It's easy. It's a blood test.
It's just a blood test. It's not like what you think in the jokes. It's not.
Correct. We do that too, but the reality is the blood test is what tips everything off, and that's the easiest part of all.
I want to ask you before you go, how and when should men get tested if somebody's watching right now?
Yeah. Age 50, if there isn't a family history, and if there is a family history, father, brother, uncle, they should start getting tested at age 40, at least once a year.
Dr. Carl Rossi, you guys are doing great work. We appreciate it. California Proton's Cancer Therapy Center. Thank you for coming in and kind of talking to us about all this.
Thank you.
We
Pleasure.
appreciate it. Thank you.